Shall we, I guess, start with the Pledge of Allegiance or something? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. I guess we will not have a trustee report. Commissioner Cassidy sent, I guess, you an email.
Correct.
Effectively resigning. Well, we won't do it today, but one of the orders of business next year will be to get identify a trustee. But let's not spend a lot of time on that today. If we do have a quorum, then let's go ahead and move to our action items. The first one up is the modification of the bylaws of the health district. Before I call for a motion, allow me to just make a couple of comments. I want to personally thank the members of the subcommittee. Some heartfelt effort was put into the creation of this document, and everyone contributed in a meaningful way. And though they're not here, I also sought the counsel of several commissioners, and they contributed wisely to the finished product. So I actually think we should be reasonably proud of what we generated. Anyway, so I will entertain a motion. Duke?
Yes, I would like to make a motion to adopt the role of medical director as an amendment to the bylaws.
Okay. Do we have a second?
I'll second.
Okay, wonderful. Any discussion? Well, there had been a lot of discussion in the subcommittee, so actually I can see why we're now winded. Eric, would you like to make a comment?
Thank you, Mr. Chairman. Simply to put that as a component of sharing quite a bit of information with our new legal counsel, there had been input in regards to this position or the creation of this position. And specifically to the concern that the existing powers of the board and some of the director would be ceded to this position through the creation of this medical director position. That being said, as we've previously discussed, the statutes don't prohibit, the board moving forward with this action. And I believe the way we had addressed that, these concerns were brought up during the subcommittee meeting. And I believe the way these were addressed is that if there is concerns with regards to determinations or input from the medical director, that those would come back to the full board for resolution.
Right, right.
Mr. Chairman, in fact, I was going to ask about that. From my understanding, from what her report was not necessarily that it was against statutes, but that it was just not specifically delineated. So what we're doing is we're, in essence, kind of breaking ground here, but it's not like we're going against anything. Was that a correct interpretation?
Yes,
Okay.
that is exactly correct.
Okay.
Yes, and when I went to the statewide meeting, Eric and I went, I queried my peers at that meeting and to find out, well, what have you done regarding a medical director's position? Now, District 2, I believe, is that the one that Zoe, whatever?
Oh, District 3.
District 3.
Nikki Zog.
Yeah, okay. District 3 had a pretty well-developed. As a matter of fact, I frankly plagiarized a lot of it, to be quite honest with you, because it was a good product. Now, we modified it. In fact, we modified it substantially. But as for the other districts, they didn't have anything. In fact, I would talk to a chairman and say, do you have a medical director, and do they have a job description? Well, I don't know. I mean, they didn't even know. So, this is breaking ground without a question. And Seth Grigg is most interested in knowing what our finished product is. And we'll send him a copy. And this will get discussed at future state meetings.
Okay.
Yeah.
I mean, it's interesting to me that there hasn't been, seemingly prior to this, local input into the health of a local area. I mean, it seems like it's primarily come down from above, and I don't see any portion of the country as an exact duplicate of any other portion of the country. I think there should be, some local input, and that's kind of the purpose of this, which would make sense. I'm surprised this hasn't been kind of integrated before to a great degree. Do you have a thought, Eric?
Mr. Chairman, if I may, we do seek public input, and that's part of the community health assessment that is done, every 5 years at a minimum, and it is reaching out to, to area providers and to the public and other stakeholders to try to identify what is unique to our area and where we should be applying our resources and efforts.
And I didn't, if my wording came across as not public input, what I meant to say, if I'm understanding correctly, was local input. Not local from a public standpoint, but local from local health director standpoint. In other words, having which is in essence kind of the emphasis behind this position, is to have a medical perspective, a local medical perspective, opinion of the health of the area, not just the public perception. And so that's why I'm saying that it's to me it would seem to be fundamental. Because a disease process in different parts of the country very commonly manifests differently depending upon health and regional influences, et cetera. And we don't approach a patient as if, well, you're just one of 350 million, and so I'm going to treat you like the other 349 million. Every person is unique, and so that's why I think that all of the regions should be looking at medical input at a local level as well.
Mr. Chairman, if I may, and I'm not sure if I'm directly addressing your question, but the statute does require that we have either a physician on staff or a consulting physician, and we have met that requirement. And we do have a current MOU with Kootenai Health Family Medicine, I believe. So when issues do arise, or for ongoing standing orders, we do reach out to a local physician to provide guidance on those matters.
Okay, good. That's very helpful, because I just wasn't as aware of that. I knew there was someone in that position, but I didn't know how often it was that information was obtained. Great.
And we're going to loop back to the MOU in about 5 minutes. So hold on to that thought.
Okay.
Okay, well, we've got a motion and a second. If I'll do this in the negative, anyone who objects to the bylaws changes, please speak up. Otherwise, your silence will imply consent. All right, well then let the record stand that it's a unanimous consent. The next item is the selection of a medical director. We have obliquely, had discussions that Dr. Johnson would fit this bill. I guess you have 3 options. Drs. Jameson, Fletcher, and Johnson. Jameson doesn't want it. I don't want it. Duke?
Yes.
No, on a positive note, I think he's perfect, as a matter of fact. Is it kosher for the chairman to make him? a recommendation? Can I do that? Or should I ask
I,
others?
I have a question about this.
Yes, sir.
Is there going to be monetary compensation for this position?
Oh, that's an excellent question. Yes. Okay, well, we'll take the opportunity right now to address your point. Once the medical director has been chosen, then the next order of business will be to the development of a memorandum of understanding, an MOU. And so essentially, Dr. Johnson and Eric and myself and legal will banter around and come up with an MOU. A component of that MOU will be compensation. Now, in my conversations with Dr. Johnson and Eric, we don't have money in the budget right now for much of a stipend, but as we move into the budget period of time, which I believe is in the spring, then your question will come up in the spring and we'll revisit it. And I would ask you to be giving thought to what you think an adequate compensation should be.
Yeah, that was my only question, was the fact that at a county level, we try not to add any positions during the course of the year. We build them into the budget for the following year.
Yeah.
So that was my only concern.
Yeah, and your concern is strong. And with Dr. Johnson's indulgence, we're going to have him essentially work for nothing for, I don't know, X number of months, and then he'll receive a stipend of some measure in the middle of next year.
Okay.
Does that answer your question?
Yep.
Okay, perfect.
If
Well,
I
I'm
may
going to
make
make a motion that it be Dr. Johnson. Do I hear a second?
I'll second that.
Okay. A discussion? Okay, hearing none. Again, I will call for a vote in the negative. Anyone who objects to Dr. Johnson, please speak. Okay, let the record stand that the vote is unanimous, and we now have a new medical director. Congratulations.
Thank you.
So just to reiterate and to follow up on what Commissioner Brutland was bringing up, we will need to move forward with an MOU, and part of that will be a compensation package. And the money is just not in the bank right now. Currently, we pay $100 a month stipend, but your job description is appreciably more than what it has been. So that's not going to be an adequate compensation. So you need to think about what you're worth. And I have thought about what you're worth, and we'll pool other people's thoughts as to what, now we know in the eyes of your mother, you're worth a lot.
Well, unfortunately, she's not with us, but no, but I think we're thinking long-term too as well. In other words, if there's being, it depends on how it's ultimately defined. If there's a significant amount of time commitment involved, there's going to be a lot of people who aren't going to be interested in the position unless there's something. So I'm not thinking of this from my point of view as in the position's point of view. And that'll all be part of the discussion moving forward.
I couldn't agree with you more. If you want some meaningful performance from a medical director or any employee, you're going to have to compensate. Otherwise, you're not going to get the caliber of person that you really want for that position. So I wholeheartedly agree with what you're saying. Do you want to comment on the development of the MOU?
I think the only comment, Mr. Chairman, that I'd like to make is, per our discussions, there needs to be agreeable terms that are defined, and then upon that, it will come back to the board for ultimate review and approval.
Yeah.
Yes, right.
And it'll be obviously important to have legal review everything because we want to make sure that it's absolutely completely above board. There's no question about creating a position for any personal gain. That's not the purpose of this. It's for local input into the health of the region. And if that local input has a lot of time requirements, then it's reasonable to provide some compensation, but we just want to make sure it's absolutely clean for sure.
Right. No, I'm wholehearted
Mhm.
agreement. Well, we are on to the next item, the consent agenda. Again, I'd like to deal with this. Anyone who wants to address one of the items within the consent agenda, now is your moment to extract that item for discussion. Let me add, I have actually looked at them all and they're okay with me, but if anyone wants, Tim, if there's one of these items you want to extract, this is your moment. We'll discuss it.
No, I'm fine with it.
Okay. Am I not hearing any extractions? Okay, that silence speaking, then I'll take a motion to approve the consent calendar.
Mr. Chairman, this is Glenn Bailey. Can you hear me okay?
Yes, sir, we can.
Okay, I would make a motion that we approve the consent agenda as here presented.
Okay. Do we hear a second?
I'll second.
Okay. Given that no one wanted to extract anything, then I'm assuming there's not going to be a whole lot of discussion. Shall we, again, I'll vote in the negative. Anyone who disapproves of the consent agenda passage as stated, now is your moment to speak. Okay. Given that silence, then let the record stand that the consent agenda was approved unanimously. Next item is the monthly fiscal report. Eric?
Thank you, Mr. Chairman. Christine had to go home ill late this morning, so I'm going to do my best to cover this request on her behalf. The short version is a request for the board to move general funds into the committed fund category. I'll do my best to walk through this. Cash on hand currently at the end of the 5th month of the fiscal year, we have about $1,400 in petty cash. We have $680,000 in our operating account, and then about $6.5 million in investment accounts, and then also about $100,000 in the Millennium Fund. Currently, we have $750,000 in board committed funds. We have about $500,000 in program restricted funds, and then about $2.4 million in opioid settlement funds, which gives us around 4 months of operating expenses. And as you've heard Christine mention before, she ideally likes to see us have about 3.25 to 3.5 months of operating expenses on hand. So the intent of this request is to move $470,000 from general account into board committed funds. The intent of that is to move $400 into building maintenance. Reason for that is that this building is rolling up on about 20 years old. We are having some challenges with our HVAC system. The expectation is that the lifespan of any HVAC system is between 20 and 25 years. Quotes on replacing some of the large roof mount units is around $400,000 to $500,000 for the 4 of them. So this is basically pre-planning. We're setting money aside in an incremental amount each year so that when those expenses do arise, we have the money set aside and we don't have to go to the counties and say, hey, we're short $400,000 for some significant improvements that we need to make to the buildings. So that's $400,000 of it. $50,000 of it is going to be set aside for IT expenses. We recently had to do an upgrade on our server to the tune of about $230,000. The life expectancy of those IT systems are around 5 years. It's almost I don't know if it's technology or a planned obsolescence, but in any case, again, same reason is we're trying to set money aside incrementally each year to anticipate those future costs. And then the final category is 20,000 of that, along with 63,000 that's interest from one of our investment funds to be set aside for a 27th pay period that's coming up in fiscal year 28. So again, setting money aside for that additional pay period so that we have those monies in our account and can cover those costs without being in a difficult position. Any questions regarding the summary I provided?
Everyone happy? New medical director?
No, it does make sense, to be prepared for anticipatory costs. Yeah, I don't see any negative with that.
Okay.
Mr. Chair, it is an action item, so if we could have the board take
I'm
a-
sorry. Thank you for bringing that to me.
Mhm.
Oates, can we take a motion to accept?
I'll make the motion to accept
Do
that.
we hear a second to accept the budget? Well, it's not really a budget, fiscal report.
Yeah, increase in board committee funds.
Right. To shift the money as requested.
I'll second that.
Okay. Any further discussion? Okay, hearing none. Again, a vote in the negative. Anyone objecting to the report, speak up. All right, hearing none, let the record stand that the action passes unanimously. Mr. Director?
Thank you, Mr. Chair. I just have a couple of items. We can move past the first one fairly quickly. Just wanted to bring attention to the board that as per the recommendation and ultimate approval of the board, Lake City Law has been retained as Panhandle Health District's legal counsel of record. That letter of engagement is in your board packet if you would like to review that. So I just wanted to make that clarification, and it was in our consent agenda today as well. The Kootenai Health Community Health Assessment. This past year, Kootenai Health transitioned from a public hospital district to a private nonprofit. They reached out to us because under that new designation, they're required to do a community health assessment every 3 years. We've been doing one for 5 years, so Kim and I met with their leadership. Essentially, they're looking for a partnership because these community health assessments do come with a significant cost. It was a good discussion, and frankly, the conversation went to reaching out to because we all serve a common populace. The discussion went to potentially partnering with not just Kootenai Health but other area hospitals and possibly Health District 2 to develop this community health assessment. Another interesting point of discussion was District 3 and their area hospitals had developed an online database which made this, instead of having a 100-page, a fairly, lengthy written document, it put all of that health data into a queryable format. So if you have different aspects of, different nonprofits or different hospitals, they could take a look and again, see where the needs within the community were. And I believe that tool also would share what nonprofits were working on what needs. So it minimized the duplication of efforts within the community. So that's another thing that we're exploring as we look into that, sharing that responsibility with Kootenai Health.
And you said that Panhandle Health normally does that every 5 years?
Yes,
Okay, and so they have a requirement of every 3 years?
correct.
So has that been done in the past at all?
Not by Kootenai Health.
when you say substantial costs, what does that mean?
Kim, if I could ask, I want to say it's 40.
Yeah, sure. It was approximately 38,000 to
Okay.
complete it.
Mhm.
And that was with going with a consultant. We had previously in the past gone with our own staff completing it, which actually probably worked out to be a lot more time, a lot more money. So it was a savings to do it with a consultant and partnering, even if we did it every 3 years, which makes sense. Partnering with everybody to not duplicate would still probably take our costs down if we're able to share that. To share that burden. So
So they would take responsibility somewhat, whatever percent is decided.
correct.
Got it.
Correct. I think there's probably a lot more discussion to be had, but
Got
yeah,
it.
seems like it's
Okay.
moving in the right direction.
No, I mean, overall, it seems like it would cost less. Okay,
Absolutely.
good.
Yeah, even done every 3 years versus the 5.
Right.
Mr. Chairman, if I may, I wonder if like Heritage Health or there's other organizations that may want to jump in on that because I know they complete a community health assessment as well. So it might be an opportunity that we could actually partner with other organizations and do one community health assessment for the Panhandle, possibly. Just a thought.
Yeah, and that was where the conversation was going, to not just share the costs, but also to have a more comprehensive
Right.
report. And again, I think what was very interesting to me was providing that, making that information readily available to the public. I mean, in a written form, you've got to go through a lot of pages to glean the information if you're, looking for meaningful data. And the example that they use, is it the Idaho-Oregon Health Atlas? And they partnered with Boise State University to develop that and to get that up and running. But I think it would help. It would help the community know where the issues were and how to focus community resources.
Good.
Okay.
The final item that I have is just noting the Benewak County has selected a nominee for the Board of Health, the open Board of Health position. And that individual that they've identified is Peggy Kavala, who is attending this meeting today. I do have confirmation from Commissioner Lampert on her selection, and I do have a resume from her that will be going out to the 15 county commissioners along with ballots, which hopefully we will be able to get those back by our January meeting and tally those results and have the Benewak County Commissioner position filled. It will be filling the remainder of Marlowe's position, which expires June of 2026. And I apologize, I had intended to put Peggy's resume into the board packet. I did not. I will share it with the board members. She has a distinguished career as a nurse practitioner and participation in numerous, the Idaho State Hospital Board, the Benewak Community Hospital. So she comes with clearly with an interest in public and community health.
Welcome.
Sorry I'm late.
You missed all the excitement, kind of. Well, that's great. Well, we look forward to meeting her. Anything else?
That concludes my report. Thank you.
Okay. Well, we're at the end of the meeting.
I've been
Why
listening.
don't you-
I've been listening to it.
Okay. Do you have? Yeah, I'll tell you what. You have the floor. You can say whatever you would like.
No,
You're
think it
happy.
was- I'm happy. It was a quick meeting. And I was trying to get here from Spokane and things just weren't happening like
That's
I liked
okay.
it
That's
to.
fine. We appreciate your at least hanging in there on the phone. And
I just had some comments for the public comment time, so.
well, by the way, I had given thanks to the subcommittee members. Well, actually, Glenn Bailey here attended all those meetings and participated actively. So I had thanked, everyone for doing that. At that time, you had yet to call in.
Yeah.
So now I want to thank you personally
Well, thank you.
because I think it was a very worthwhile product. I think we came up with
We did a
something
good
good.
job.
All right, so you wanted to you wanted to say something in the public comment section?
I did, just to the other board members and staff. I just heard yesterday that Marlo Thompson's wife passed away.
Oh, I'm sorry.
And I thought, I'm going to send Marlo a card of condolences. I think it would be appropriate for the other members to do so, or to sign it if you like.
Absolutely.
So that was my public comment. And yeah, Marlo did an excellent job for years and years representing Benoit County. And
Since 93.
yeah,
Wow.
and I know that he is heartbroken now. And his wife passing away, they were like this.
Right.
Every December, Christmas time, he insisted on going to all of the health offices throughout the 5 counties and delivering them Christmas goodies and saying thank you. So he did an excellent job doing that. Yep. So sad to see his wife passed away, and I know he's probably heartbroken, but I'd like to send him a card.
Thank you.
Absolutely.
Thank you
That's all
for
I
doing
have to
that.
say.
Okay, well, let's pass that around
Okay.
and sign it. Do you have a pen? Thank you. Right?
Okay, that's all I had, Mr. Chairman.
I guess I will make a comment as we're passing this around. Mark your calendars for May 10th, 2025. That is the date for the strategic planning meeting. And the Kootenai County Board of Commissioners have been kind enough to lend us their conference room in their county building. And as we'll talk more in the spring as to the parameters of this planning meeting, I'm anxious to get everyone's input. How do we want to run it? What do we want to accomplish? So on and so forth. But at least we've got, and Seth Grigg has agreed to facilitate the strategic planning meeting. And I chose him in particular. He's talented. I think he's a really talented human being. And I've witnessed him facilitate such a meeting, and he's good at it. It takes a certain skill. But then my secondary intention, and Duke, this really drives to your point you were making about, have any other districts gone to the trouble we have to define a medical director's position and some of the defined structure of that definition? What does it imply in terms of our willingness to take ownership of our own operation? Well, I want Seth Grigg to witness this up close, because there is no one in this state who understands county level politics better than Seth Grigg.
Huge influence. You bet.
Huge influence. So if we're doing something worthwhile up here, way up here in the Panhandle, then we would like to advertise that, and he would be a mechanism to spread the word. On the other hand, he may say that what we're doing is a waste of time. Well, that's always a possibility. Anyway, so there you go. May 10th, Kootenai County Building from 9 a.m. to 4 p.m.
Great. Got it on my calendar there.
Any other comments? Do I take I'll entertain a motion to adjourn?
Well, I would like to make a motion to adjourn.
You would.
But I would second the motion.
Okay. Again, a vote in the negative. Anyone objecting to the idea of adjourning, please speak. Otherwise, your silence will imply acceptance to adjourn. Okay, let the record stand. The vote was unanimous. We're done.
We're off the
Well,
record.
thank you.
Yep, sorry I'm late.
Oh, it's no big deal.
All right.
And we're still holding to under an hour. I like that.
Yeah.
If you do your homework ahead of time, then you don't have citizenry. You know who I feel badly for? Some of these commissioners who have to deal with militant citizenry.
Oh, yeah.
Or the other kind that's really bad are the dumbasses. You get both. You get some that are outright militant. And you just have to be patient with them.
And others who haven't got a clue what they're talking
And you
about.
got the other that don't have a clue.
Yeah.
But you can't brush them
You
off
can't
because
educate them right there because
it's
You're gonna tackle me, right?
yeah.
it's that.
So we have the luxury of being able to move through the business.
Okay, we'll see you next
You know, I can imagine a board of commissioners could do their work in half the time if you didn't have some of the.
Oh, yeah. Oh, you could.
So did you